So this is 18.2% of the country's total tally. 451 people have died and there have been close to 16,000 recoveries in that province. So the health system there is overwhelmed already as the number of infections continues to rise. The virus is expected to peak in that province in the months of July this month, August and September. The Eastern Cape Department of Health Superintendent General Dr. Thobile Mbengashe now joins me on the line to chat about the province's continuing fight against the spread of the coronavirus. A very good evening to you, Dr. Mbengashe. I'm sure you can hear me. Good evening. Dr. Mbengashe, good evening. It's Griselda. Can you hear me?
Yes, Griselda, I can hear you. Good evening to your listeners, viewers as well.
Thank you very much for joining us, Dr. Mbengashe. So let's start here. We've seen quite a number of reports suggesting that patients are sleeping on the floor and fighting for space in your province's hospitals. Has the Eastern Cape Health Department or its facilities collapsed?
No, not at all. I think what we had what is called a surge stress at one of our hospitals, Doranginza. The problem there was that the feeder clinic on maternity had actually have most of their staff members not being able to go to work, so the maternity services was closed. I think what we really experienced there was that how the level of the surge can really stretch the system, and subsequently we've managed to open the services, and the services has come to right. Now, why we say it is not collapsed is because we still have less than 1,000 patients in our hospitals. We have built over 3,000 beds for patients with COVID. We've built another 6,000 to 8,000 isolation beds. So the lockdown has allowed us to prepare for really the coming up of the surge, and we're really working hard to make sure that is happening.
The Premier of the province has already alluded to the fact that the province is indeed under pressure. It's projected that you will need about 10,000 beds. This is what you told the provincial government there as you enter this peak, and about 3,000 of which would be ICU beds. Which hospitals in the province are currently at full capacity or nearing that?
I think what is important is that those were really the projections in terms of the forecast, what we should expect at the peak of the surge. We know that when we reach August, September, this is the highest number of patients that we actually expect. In terms of beds that we could have to meet, most of our forecast says we can actually reach the 10,000 number of beds that's required. Where we're running short is in the ICU beds. We have about 300 ICU beds, and we need about 3,000. But what has really been helpful lately is that there has been more new knowledge about what is it that we need to do in order to manage COVID patients. Oxygen is our number one priority. And secondly, that when we deal with the storm from the immune system, the dexamethasone is important. So we are now rearticulating all our beds to have oxygen support so that we're able to take more patients than we would have taken if we had to rely on ICU.
Which hospitals currently, the last part of my question, Dr. Mbengashe, was which hospitals in the province are nearing a capacity at this stage or are at full capacity at this stage? If you could give us a breakdown of that.
Yeah, Port Elizabeth is one of the hotspots, and we have the highest number of new cases that are required for hospitals. Luckily, we have been able to meet our demand requirements because we've just opened up the VW South Africa Dr. Mamisa Ngweni Hospital, which will take another 1,500 patients. It opened on the 1st and is actually ready to decant most of the patients and actually provide excess capacities. So that's number one. In the second area is the DCM, that's East London area, where there's a huge number of patients as well. Again, our preparation and the hospital facilities that were built are coming up online. And then the third area is around Umtata and OR Tambo, where there's still going to be a big demand. But I mean, where we're hearing the stress is in Port Elizabeth area.
distress in the Port Elizabeth area. There were some posts that had also been made by what seemed to be some concerned individuals in the Eastern Cape. Allegations of a strike by cleaners there, and there seemed to be a whole lot of rubbish that had been in the wards within those areas. Are you aware of that situation as a result of a strike by cleaners, and has that been sorted out?
Yes, there was a cleaner slowdown in the Livingstone at the emergency, not in the ward, and they were actually complaining that if they are not going to get an access overtime, they will not do overtime. We have resolved that. We've given some overtime, but we're also recruiting additional cleaners to make sure that the burden of cleaning of the facilities, Livingstone is okay, and the rubbish is no longer there. It has been removed. The cleaners
not have happened, Dr. Mbengashe. I'm sure you would agree with me. That should not have happened in an instance where we're faced with a pandemic and the Eastern Cape Health Department has agreed or agrees that you're significantly under pressure at this stage.
No, that's true. What we are saying is that we must recall that the issue that we have, and this is really one of the biggest challenges that has really made our stress on our health services, our workers in terms of the general fear and anxiety within the COVID has created a much more additional stress for our services, where we're finding patients and healthcare workers very reluctant, especially if there's been any one of their colleagues that has been infected, and most of them demanding to be tested and being out of work. And that has created another dimension in our stress for hospitals. But I think the key issue for us is that the lockdown has really helped us to prepare. We are preparing for a surge, and we have built those structures to deal with that. We are expanding the oxygen, which we think now is a big issue that we need to do, and new development are helping us to reduce the number of ICU beds that are going to be required.
So as a province, what are your projections in terms, as you enter this peak, how many people in the province will be infected? What are you preparing for?
Actually, now we're about 30,000 plus. We think that number is going to double by the end of August to September. That means that 80% of those individuals will be what is called asymptomatic. The big area there, we need to make sure that we're providing isolation. The other 20% will be in what is hospitalization. We think that the number of the beds that we've created, over 3,000 beds with oxygen reticulation and actually provision of the dexamethasone, will give us a list of life to make sure that we don't really need to have the ICU that we had planned to have. We are building over 300 ICU beds, which are going to provide what is called invasive ventilation. We think we should need that if we really apply the new case management of patients.
The Eastern Cape is also the highest number of learners and teachers infected with COVID-19. I think the last time I checked it was at over 1,000. What are your latest figures? And I'd really like to know from you as a province whether you would consider recommending to the National Coronavirus Command Council whether schools should be closed again. Is that something you're considering as a province?
I think what we are worried about is that the number of new cases is over 1,500 on a daily basis. It's been steady in the past 5 days. We also know that if you look in terms of the stringencies of control as part of the lockdown system, having schools that are closed, that's what we had in the first lockdown, workplace that has been closed, that's what we had in the lockdown, actually reduced the number of cases. But what's really important is now to create a balance between what we can do as public health and allowing economic activities to work and actually working and dealing with the social restriction. What we are really pulling in and pushing very hard is that young people, even in school, and the young people outside school must take their responsibility of making sure now we are wearing masks. We think that if we really make sure that the PPE and other systems are actually provided, it is true the numbers that we have are way beyond that we really think the health system can handle. And those decisions are being considered on a daily basis. I can't tell because this is a decision of the national job. They've got all our data. We're providing all our information. But
is it something, Dr. Mbengashe, that you would support given that you have the highest numbers?
Look, what I really would support is the stringent applications of the lockdown provisions. And I think that can do a long way. What we really mean, we mean that all South Africans must accept the fact that wearing of mask is now mandatory. Social distance is important. Washing our hands, not attending gathering, funerals, and other places where there's gathering. Those are strict elements. If we apply those, we'll gain a lot of work down the line. It is true, when really those things are not working, a lockdown, which is a mandatory lockdown of restriction of people, has been shown to actually have a very highly effective way of reducing the numbers. But that decision has not been taken. It has not been really something that we're working on. We're still working on strengthening the current lockdown provisions.
Thank you very much indeed for your time this evening. The Eastern Cape Department of Health Superintendent General, Dr. Thobile Mbengashe, talking to us about their continuing fight against the spread of the coronavirus in that part of the country. Thanks indeed for joining us this evening. Let's take a